Ah, my gorgeously doomed scholars. Your loyalty warms what's left of my calcified heart. Tonight, we descend into the cruel embrace of aortic stenosis, the rusty door hinge of cardiology, where every beat is a creak, every systole a scream. Compared to this, even our old flame aortic dissection looks like healthy boundaries. Etiology, why your valve is a drama queen. Degenerative calcification leads. Around age 65 and over, the valve turns into a bony chandelier. A bicuspid aortic valve is a congenital shortcut to early doom. Rheumatic fever is a third world throwback, causing valve cosplay, stenosis and regurgitation. Unicuspid or quadricuspid valves mean the valve forgot basic math. Radiation therapy is a chest cancer cure turned side quest. Familial hypercholesterolemia causes calcium deposits before your student loans do. Mnemonic, be real, don't be retrocongestive. Pathophysiology, the rusty gate. Lipid buildup leads to macrophages gossiping. Calcium rain causes the valve to turn to stone. Leaflets stiffen, and systolic opening becomes impossible. Left ventricular hypertrophy makes the ventricle bulk, like a toxic gym bro. Ischemia and heart failure occur as the heart demands more oxygen, but the valve ghostly supply can't keep up. Here's a humorous knock-knock joke. Knock-knock. Who's there? Stenosis. Stenosis who? Stenosis your blood flow, darling. Clinical features, the classic tragic trio. Exertional dyspnea means the heart refuses to keep up. Angina signals a supply-demand mismatch, and 50% of patients also have coronary artery disease as a side issue. Syncope is fainting faster than your exam motivation. Other symptoms attending this funeral include heart failure signs such as PND, orthopnea, edema, and pulmonary crackles. Atrial fibrillation is present because chaos loves company. GI bleed, known as Heidi's syndrome, happens when the valve shreds von Willebrand factor, causing the gut to bleed on cue. The exam murmur is a harsh mid-systolic sound, crescendo-decrescendo in nature. It is loudest at the second intercostal space on the right and radiates to the carotids. A clue to severity is a late peaking murmur, which indicates a worse condition. Severe cases present with a soft second heart sound, narrow pulse pressure, and pulsus parvus et tardus. Remember the mnemonic DASH, dyspnea, angina, syncope, with heart failure sneaking in at the end stage. And now, the real blood-stained opera begins. You've heard the tragic trio, dyspnea, angina, syncope. But how do we catch the culprit? How do we fight it? Let's sharpen our scalpels. Investigations begin in the valve CSI lab. ECG LVH in 80%, atrial fibrillation, and CAD side characters. CXR, calcified valve posing for its X-ray glamour shot. Echo TTE, the truth serum, velocity, mean gradient, valve area. Stress echo, unmasking symptoms like a bad party guest. BNP, the heart's cry for help. CT, MRI. Cine shots for the cinematic snobs. Coronary angiography. If surgery is on the menu, every calcified echo shows trouble. Remember this mnemonic. Management options to remove the rust of aortic stenosis. Symptomatic severe AS carries a 50% mortality rate in 2 years if untreated. The definitive treatment options include SAV, which stands for Surgical Aortic Valve Replacement, TAVI, a catheter-based magic procedure, and balloon valvotomy, a temporary fix for kids, young adults, or for palliation. For mild or asymptomatic cases, the conservative approach involves medications for heart failure and yearly echo surveillance. Are you TAVI? Because you just opened my heart when nothing else could. Complications arise as side quests of doom. Heart failure leads to LV hypertrophy, fibrosis, and diastolic dysfunction. Sudden cardiac death occurs in 1% per year, if asymptomatic, rising to over 30% if not. Arrhythmias include AFib and ventricular chaos. GI bleed, as in Hyder's syndrome, causes anemia and angiodysplasia. Endocarditis makes bicuspid bros suffer worse. HASD, the mnemonic for complications. The prognosis stands as the clock ticks on. Without valve replacement, the median survival once symptoms start is 2 to 3 years. With surgery or TAVI, survival rockets up to 80 to 90% at 5 years. As we conclude the opera of heart murmurs, remember that aortic stenosis is the gatekeeper of doom, creaky, calcified, and cruel. Remember, dyspnea, angina, syncope, the tragic trio. Replace the valve or watch the curtain fall. Now go, my cardiac darlings. Leave me your bravest questions, for I shall roast 3 comments in the comments section.